All right, everyone, we're here for another video here at Life Without Fear Chiropractic. If you haven't smashed that like and subscribe button, go ahead and do that to make sure you never miss a video. In this video, we're gonna go over one of my favorite exercises. At the end of the video, I'm gonna go over more of the education of who this is for, what it's used for, but in the beginning, I just wanna get right into the exercise. It's called the ATG split squat. So it's a company called Athletic Truth Group, the knees over toes guy. We use a lot of their exercises because they're just the best. What you want to find is something that's elevated. So I like a chair. I have a slant board and I'll put it on mats or things at the gym. We want to start elevated first because I'm going to show you the priorities. We have two priorities if you're taking notes. There's going to be priority 1 and priority 2. And you probably guessed it, priority 1 comes before priority 2. Priority 1 is getting our hamstring of the leg that's up flat against our calf or as close as we can. Again, we shouldn't be forcing it if it's painful. It should be a little uncomfortable. But we're not setting a world record. If it's painful, just go to where you stop and just work on it every day until eventually you can get that hamstring against your calf. So priority 1 is gonna be hamstring. I'll bring you in here. Hamstring against the calf here. And then you can see my knee is over my toe. It's out in front. We're not sitting back like this. Knees over the toe. We'll get that right over here. Once we get that, priority 2 is going to be getting this back leg straight. What most people will do is if you look at that toe, it points out, right? That's a problem for our pelvis being out of position. What we want to do over time is get that toe in. If your leg needs to be bent, that's okay. And then eventually we want to get to where that back leg's completely straight. And then we pull that chest or torso. We don't want to lean forward. Priority 3, I guess there's 3 priorities. Priority 3 would be the chest and torso up tall here, like this. So this would be the darn near perfect ATG split squat. You can see how tight my hip flexor is. I still can't get that back leg completely straight, but that's what I'm working into. And then we'd sit and hold for, you can do this for a 30-second hold each side and come up. Or for me, I like to do 15 reps, 3-second hold at the bottom, and then back up. And then I'll go in, and you see I'm not bouncing, slow and controlled. 3-second hold once I get into it. And then slow and controlled on the way up. So you can hold it for 30 seconds on each side, do 2 sets of those, or you can do 15 reps each side, doing it that way. So that's priority 1 is getting that hamstring again against the back of the calf. Priority 2 is making sure we're in alignment and getting that back leg straight. Priority 3 is a tall chest or torso. Then over time, I'm hesitant to say this because I know a lot of people are gonna be like me out there and they're gonna try to work all the way to the ground, right? But you'll lose form. So the goal is until you can get it perfect, we shouldn't be going to the ground. You can see when I come to the ground, I lose a lot of form because that back leg's super bent, right? You'll get more out of it if you stay elevated and then you keep that back leg straight. So you can see how I sacrifice the form and the priority is the lower I get, but eventually over time that is the goal to work towards the ground. So that is the ATG split squat. As far as the people that should do that, people with knee problems, it's gonna be great. It's gonna traction the knee open. People that have tight quads or hip flexors, the quads are a part of that hip flexor. This is an easier, you're gonna stretch that as you're strengthening and regenerating that knee tissue there too. You also start to develop muscles around the knee to help support your knee. So your quads and your glutes will also start to develop from doing this. Also great for people that do like a back squat, because I see this a lot at the gym, self-included. This is why I got away from doing back squats or front squats. I'm not telling you forever. But what happens is, right, if we have imbalances in our pelvis, which we view on x-rays, and you go down like this, right, you can see the imbalance here. So we're basically strengthening the side that's already strong, and we're keeping the other side immobile. We're compensating for that. When you do a split squat, you're actually isolating each side to give it exactly what it needs to develop mobility in those areas. And then once that mobility is built, then we can get into something like legit back squat, which in reality should be done with lifts underneath the heels. Again, in our shoes, we don't want heel lifts, but when we do an actual squat, we want to do that. We should get what I call cheeks to sneaks, right? Because we're getting that full range of motion in the knees. We're opening that knee joint. The knees are over the toes, which is how you develop your knee joints, right? And you actually develop all of these muscles much faster because you're doing a squat actually correctly versus doing this, which is terrible for your back. Right, this is terrible for your back, so that is my recommendation for it. But give this exercise a try. It's one of my favorite. I do this at least 3 times a week, but it's one of my favorite, and will also strengthen So strengthening and opening that knee joint, but also stretching that hip flexor on the opposite side. But I'll see you on the next video. Again, if you haven't already, hit that like and subscribe button.